Anyways, we don't want to delay our presentation, so Uday, you want to come up? Uday's one of our vice presidents, and his specialty, his interest is in housing, so he's going to introduce our presenter.
Thank you, Kathy. So, who has not heard about housing crisis? My role, I'm on the board of NAMI, and my role is housing, VP of housing. And I'm a family member. I have a son who has been a struggle to get the right housing for him. And we are warm line. We receive calls from family members, and the dominant part of the calls are about housing. Of course, this has been, made worse by the prices of houses that have the cost of living has gone up tremendously. But the problem had been tackled by several people. And one of the issues that we encounter is the quality of the places. In other words, Ronald Reagan disbanded the government institutions, and all the family members or the patients were distributed in the community, and with a view that they'll be taken care of. But it has been a fairly, bad record, especially for the mentally ill. I think in the case of the developmentally disabled, at least there is better, coverage through the state. But for the mentally ill, the budgets and the problems, the people that house these people with a mental illness, they run those places as businesses. And a lot of times their welfare is not their primary concern. So several years ago, there was a coalition formed. We call it the Community Living Coalition. It's a coalition between the county, NAMI, MHAP, Mental Health Advocacy Project, and disability rights. And what they said was, we want to look at the quality of the unlicensed board and care. They had, higher goals, but some things became more realistic by looking at the unlicensed, at least in the beginning. So there are people here that will be, I'll ask them to come and sit and they'll talk. But I've seen that the amount of work that these folks have done to make this coalition come to the stage that it has today is just amazing. It's all volunteers, and they're doing an amazing job. But now we have reached a stage where we need support and awareness and advocacy. This also, I forgot to mention that it's a partnership also with the providers. They are a very important part of it because they have to understand what the needs are and what are the right things to do in terms of the quality of food and the rest of the conditions in the living quarters. So what I like to do is maybe ask the folks to come and sit on the chairs here, and they'll be the people that will go around and talk about their initiative. And then we'll come back actually and talk about what we really need from the community and from the county. So with that, we have Young Fang. He is an attorney with disability rights. We have Hillary Armstrong, and she is with MHAP. Lorraine Zeller, she is with the county peer support. And also John Hardy, also with county peer support. So whoever wants to go first, maybe Young, you want to go first? So thank you.
So there's 5 of us, but the coalition it actually consists of many more components and many more folks that have also contributed their time. So Garrett over there, say hi, is also a member, and Wendelin is one of our sole founding room and board operator member. So we're inviting the room and board industry to also be part of the solution. So 10 years ago, I worked for an agency that traditionally looks at institutional settings and abuse and neglect and conditions in institutional settings. About 10 years ago, around 2009, we started looking into conditions in the community, and particularly in these unlicensed homes. And that's when for me personally, it had already, these issues had been addressed for many years before then, but for me personally, I realized that in California with our housing issues, the cost of living, and oftentimes these room and boards being the last housing option before homelessness, I realized they actually form a really critical part of the family members, the client communities that we serve and that we have. And so we started looking at how do we address poor habitability conditions, abusive conditions in these homes, and we started thinking about, well, as a law firm, the first thing you do is sue, right? And when you're a hammer, everything is a nail, right? But we learned very quickly that that's not the way to do it. The industry, specifically the bad ones in the industry, they act a lot like a whack-a-mole, right? You put all your advocacy into eradicating one home, it'll just spring up in the next neighborhood under a different name, and it'll continue. And so we won't ever really address the root cause of the problem. And so that's when somebody thought about how do we address this issue more at a grassroots level, at a systemic level. And that's when we came up with this concept that Lorraine is going to present in more detail about a coalition or a network, which basically brings this what historically underground industry into the light and provides incentives and goals for them to improve housing conditions. And by kind of encouraging best practices and changing the culture of the industry, we can then hopefully push out these kind of outlier homes. Most room and boards are trying very hard to provide a good service. They're not, I don't want to vilify an entire industry, And so by kind of promoting those homes and having those homes spread what a good practice is with the help of our coalition, we hope then to address that particular issue with habitability as opposed to kind of going after each individual home. So that's kind of where we are today. Lorraine's going to talk a lot more about it. And Illy.
So I think we're going to have Lorraine speak next.
Okay. Give me a quick view. Thank you. All right. So we're called Community Living Coalition. And as it says here, hold on. We are a grassroots network. We developed from the start by consumers approaching MHAP, Mental Health Advocacy Project, and then we expanded with family members, a lot of NAMI folks, and community partners, such as we have here, and also Momentum for Mental Health, and consumer leaders are now, working with Community Living Coalition under the County of Santa Clara employment. Another thing on our plate. But, it's all good. All right, next. So the problem this is not a very good picture, but this is a picture of in San Bernardino, patients were kept in chicken coops and it was a very well publicized problem that was brought up and actually translated, fortunately, it translated into a coalition being born in 2010 in San Bernardino County. And then these two pictures with all these, you know, a couch, a bed, a bed, a bed, and anyway, one of our NAMI family members supplied these pictures when she was looking for a place for her son. So the solution, okay, independent living coalitions. And there are actually quite a few in different stages of development in California. So the first one, the first two, actually, Young is going to talk about in more detail because he's more familiar with them. San Diego and Alameda County, they're both called Independent Living Association.
So San Diego County is actually the very first of these independent living associations. They went into operation in 2013, but they were actually started back in early 2000, around 2003. So it's been about 10 years for them to get going and pick up momentum. And we're currently, learning a lot from them. Alameda County is another coalition that I actually also am a work team member of. I work in Alameda. I live in Santa Clara County, and they're a county-run independent living association, which is different than the way we are run here in Santa Clara for now. They contract with San Diego County for the folks in San Diego to basically provide the coordination of the efforts in Alameda County. And that's why you see kind of the syncing of names so that there's a branding, so to speak, of this concept. And I want to say both of those programs, what they have in common that's different from Santa Clara is they have county buy-in. So county has supported them with resources and funding. And so although, the San Diego in 2013 when started operating, they started with, my numbers here, they started with 16 homes as part of a pilot program that totaled about 127 beds. And these are all room and board unlicensed homes. In 2017, they are now at 69 homes with a total of 604 beds. And so what that means that 604 beds are subject to their standards of living and accountability. And that's a fairly significant size, although there are many, many more room and board operations that exist in that county, and their effort is to continue to recruit. Alameda County, because of their county, has really bought in and given them resources, including their money to contract with San Diego County, has since December, taken significant strides that are even surpassing Santa Clara County. And so in May and June, we are going to start looking into doing the outreaches and coming up with the training plans for the operators so that when they become involved, there's this additional benefit to them. And Lorraine is going to go into that later. And when we have San Bernardino County, which is the first coalition that I was involved with creating, and came from that case that Lorraine just showed a picture of, and that was back in 2009. They're still up and running. And then we have a more newly generated coalition in Riverside County. And so this coalition idea is something that's picking up momentum throughout the state. We've been approached by folks in Fresno. We've been approached by Contra Costa County. And it's something that everybody is starting to recognize as being one of the only ways to kind of curb and address these issues flowing out of the room and boards. that are related to the way the housing crisis is moving and the way that it affects our consumers and clients. And so we're hoping that we're just one piece of a statewide initiative, statewide push to to normalize these types of coalitions and bring in, bring this industry into the light.
Okay, and I wanted to say about this peer-driven room and board advisory coalition in San Bernardino County. It was started by a lady named Cynthia White, who worked as a patient advocate within the county. So she was a county employee. And in the past, I think 2 or 3 years now, it's been operated by peer advocates. So they're kind of like the mental health peer support workers. So a peer advocate 3 is operating the coalition, and they're willing to give us technical assistance, as well as the San Diego coalition. So, we have support in terms of technical assistance to get this going. And let's see now. Next one. Hold on. All right. So, what the Community Living Coalition and similar coalitions develop standards for independent living homes. And briefly, I'll go over the 8 attributes of quality independent living residents that we hold these operators up to in order to become members. And that is clean, safe, and well-maintained housing, a clear statement of policies available to tenants and clearly explained prior to lease signing, clear process for handling complaints, and opportunities for tenants to positively influence their environment and remove unhealthy influences, an environment that respects the privacy of tenants, an environment free of any type of abuse or discrimination that requires all tenants to be treated with dignity, consideration, and respect at all times, concerned and competent owners, tenant assistants, clearly outlined amenities that are consistently and fairly made available to all tenants, and a tenant-focused living environment. And under each of these 8 attributes, there is a more detailed description of what does this look like exactly. So then we have a problem resolution process, which is in place and ready to go once we get all our members on board. And this too will be a pilot. So we're looking for up to 8 operators to join initially. And then we'll, kind of see how things go for, I don't know, maybe a year or so. We'll see. We'll just see how things go. And the room and board list of member homes will be put on a special list that will be distributed to discharge planners, case managers, family members, and others. And it will be identified as member-only homes that meet our quality standards and our code of ethics. And training, education, and support.
So one of the really important functions of a coalition is this one bullet of independent living home. So what that means is that if you're a member home and you adhere to these quality standards, that means that your name is on the top of the list of the providers, the dischargers, the folks that work with our client communities when they think about where to send a consumer. And so there's there's a financial incentives to drive membership as well. There's other things that Lorraine will talk about later, but this is a very critical part. So that also when discharged or even family members, when they're looking at where should my loved ones live, they can then go into our database And in San Diego, they have this really nice online database that has pictures, it lists the amenities, it lists what it's near to, addresses. They can go in, look at it, and then the family member and the consumer can sit down and say, well, is this a home that's appropriate for me? And so this one element is probably the most critical part of the coalition, this home directory that we generate.
Did you see that little girl?
Okay. Thank you. And then we will offer trainings of interest to the operators and, other members, including family members and consumers and, community agencies. And we will plan on having community agencies come to meetings and, present what they have in terms of resources for the people who attend the meetings. Also, I think it's the peer-driven coalition in San Bernardino. They have introduced a cultural element. So now they talk about a particular culture, and they have recipes and food from that culture at every meeting. So that's kind of cool. And a referral process to member homes. Did you want to elaborate?
That's basically what I just talked about, which is a process through which our clients, our consumers, family members, and can end up at these homes that are fit for them, and they are fit for the home. So.
Yeah, from the list. Okay. So the coalition consists of the residents and family members, advocates, providers, independent living operators, because we are a community coalition, and we're committed to supporting and benefiting from the contributions of every member. We each have something of great value to bring to the table. Elements of, I'm not very good with paper. Sorry. So elements of an effective coalition are, and we're going to go over more in detail each of these elements: member recruitment, independent living site visits. So once an operator completes their paperwork, and that's all, according to correctly done, then we schedule a site visit. And then it also consists of a process to facilitate any resolution of complaints and, as we mentioned, training, education, and support for operators and for stakeholders.
And again, the facilitated resolution of complaints is also important, because if you're a member home, there is this process through which operators can resolve issues with their tenants, or tenants can resolve issues with their operators, or between tenants. And the hope is that we've found a lot of times police, APS, code enforcement, all these folks are called in on things that does not really rise to the level where those services needs to be triggered. And the reason why that can be problematic is that all of those entities, when they respond with a certain mindset, especially police. And so they have certain expectations that when they're called, something big is happening. And vast majority of the time, it's not the case. It's a conflict between two tenants, just like a normal average day. And so this problem resolution hopefully is going to allow for these issues to be resolved internally within the home, preserving the peace, and also preserving the relationship between the landlord, the operator, and the tenant. And so that's a really critical element as far as the safety aspects of these types of issues arising in these homes.
Okay. And next, so the member recruitment outreach, it will be to, and is, happening now, to consumers, family members, and independent living operators, and hopefully soon to providers and dischargers more and more. And who to reach out to first does depend on the county environment or geography.
So what that means is that since we're a grassroots coalition, it allows us a lot of flexibility into factoring in who's the demographic that we're addressing, what is the geography. For example, in San Bernardino County, that's the largest county in the country, and so the way they do their outreach is going to be different than in a very compact county like Santa Clara or Alameda. The demographic is also different. In San Bernardino, they had consumers being part of the initial steps of the coalition first. In Santa Clara, we kind of have a mix. And in Alameda County, they have not yet brought in consumers. And so that just kind of is a factor of the county and the makeup of the county. And so it allows us a lot of flexibility as far as member recruitment.
So site reviews, we recruit and schedule a site inspection team, and we want to have a variety of stakeholders on this team so that, can include a client or peer or a family member, a peer and family advocate such as John and myself, and possibly a provider. And so we will schedule the site inspection. So, this is a process. Arrange the transportation, coordinate the meeting time and place, notify the operator no more than 24 hours before visit, which...
Yeah, and the purpose for doing that is obviously we don't want to give so much time that somebody can, a bad room or board operator can clean up their act and put on a good show for 24 hours and then go right back to their business. But at the same time, we also want to be fair to the operators. There are many operators that run really good homes, and it is disruptive for us to go out there and spend a couple hours looking at their home. And so we want them to help them maybe prepare for the visit and prepare their tenants for the visit. So it's striking a balance between unannounced surprise and kind of letting folks get ready.
Although it can actually happen that you schedule in advance and the operator still won't be ready. So anyway, then we convene the team afterwards to determine the membership disposition and let them know. When we let the operator know the disposition, it could be that we have decided to accept them as a member. It could be that, their place could use some help, or the way that they operate their place could use some help. They're not quite up to meeting our quality standards, but, if we feel that they are ready and willing and motivated to make some changes, we will give them some time to do so, and then they can let us know, and we'll come back for another site review. We're here to support our operators, especially those who have good intent, and so more on the complaint resolution. So we will receive and review any written complaints and contact the complainant to follow up. We'll have a process so that, like a tracking mechanism to follow up on complaints, and have a crew that will determine, what we're going to do. In some cases, it might be very easy to resolve. In other cases, it might be more complicated. Then, so we will conduct interviews with disputants and get the facts, and then do our best to mediate a solution. We will not be involved in any legal, resolutions. This is all, voluntary mediation. And then we will provide a written summary. And we're almost done. So, okay. Training, education, and support. So, with this training, we would like to expand the rights and skills knowledge to consumer population, and that could be, knowing their resident rights. It could be learning more about wellness and recovery. It could be like, the peer-to-peer recovery education or WRAP, Wellness Recovery Action Plan. It could be more on independent living skills. And the training can also help enhance the quality of the home management and operations, provide awareness, like I was talking about, having agencies come in and talk about the resources and the services they have to offer. And who can do this training? We all can do it. So consumers, family members, operators, providers, and let's see. Yeah, so consumers can benefit from, well, I already told you. And family members, maybe family-to-family education, community resources. Operators can learn more about the crisis management like you were talking about. Did you want to tell them more about the working with the police?
Yeah, actually, it wasn't really part of the presentation, but since Lorraine asked, so one of the things that we're actually looking for right now is opportunities to work with family members and peers and consumers on trainings involving how to interact with police when somebody's in crisis, whether it's a family member calling police, calling 911. What are the magic words that needs to be relayed to dispatch so that whenever the officer arrives on scene, they understand that this is a mental health crisis and not an active shooter or somebody dangerous. And we've all read plenty of media coverage about the poor outcomes that happens when police come in unprepared. And so that's something that we're looking at now. I'm not going to go into it in too much detail, but I will work with NAMI in different counties, starting here, to identify an opportunity to train folks on some of these issues. And so that's one of the trainings, and I'll probably at some point incorporate that training into the coalition work as well.
Thank you. So our last slide is, let's see, how do we do this? Okay. So this is a little short video on the Independent Living Association of San Diego and how both the operators and the residents feel about, how it's working.
Hi, good evening. So I know that we've only got about 20 minutes left. So I'm Hillary Armstrong with Mental Health Advocacy Project, and this is John Hardy with Mental Health Peer Support. And so part of what we wanted to kind of round out this presentation with was an overview of residents' rights in both independent living homes and licensed board and cares. So this is a presentation that could take a full hour, so bear with us. We're going to be speeding through, but do know that we have some handouts that we'll put in the back at the end, and we're also available for any questions. It's mostly to just kind of give you the context. So we're going to give you an overview of independent living versus licensed board and care, and talk about residents' rights in independent living, which is where the Community Living Coalition is currently focused, and residents' rights in licensed board and care homes. And then we'll talk a little bit about discrimination and evictions. So first, we wanted to just be clear about the definition, as you heard in the ILA video. Independent living homes, which are also called unlicensed room and boards sometimes, are privately owned homes or complexes that provide housing for adults with mental illness and other disabling health conditions. They serve folks who don't need medication oversight and are able to function without supervision and live independently. So you heard that as well. And general landlord-tenant law applies. And so this is why kind of the need for the Community Living Coalition arose, as Young and Lorraine explained, because not every operator holds themselves to the highest standards. And these are some of our most vulnerable residents who are living in the community. It's exacerbated by the housing crisis, and landlord-tenant law doesn't necessarily account for the power differential between residents of independent living homes and their landlords. So a licensed board and care is a facility that provides 24-hour non-medical care and supervision to residents. All board and care homes get their licenses from and are overseen by community care licensing at the state. And some licensed board and care homes also receive supplemental funding from the county to provide more individualized services or a higher level of care. So it's still short of like skilled nursing, but it involves more care. So I'm going to quickly give you some overview of the general landscape for folks in independent living, and then John's going to go over the same for licensed board and cares, and then we're going to talk a little bit about discrimination and eviction proceedings, which apply to both. So the key to independent living is the rental contract or lease agreement, and I'm going to use you because we're kind of using our consumer-based presentation, should tell a resident whether the agreement's for a fixed amount of time or a month-to-month agreement. So you could have like a one-year lease or you could have a month-to-month agreement. Whether the operator is agreeing to provide you with meals, and if so, how many per day. Whether the room is furnished. Whether the room is private or shared. And how much you'll pay in rent each month. So, sorry, there's a lot of words here. I put too many words on my PowerPoints. It's a lawyer problem. The operator of the home needs to make sure that it's habitable. So that's another important factor is habitability. And that includes plumbing in good working order, heat, electrical, and lighting systems, clean and sanitary buildings and grounds, adequate trash receptacles, working smoke detectors, waterproofing, and weather protection. And so obviously these are really important and core issues to the safety, health, and dignity of residents. And unfortunately, as we saw in Lorraine's opening slides, some unscrupulous operators have not paid attention to this and or just neglected this to the point where people are living in very inhumane conditions. And I know Young on his enforcement side sees some pretty bad stuff out there. So, and unfortunately, some families, like the pictures that Lorraine showed, people see their family members are experiencing and consumers are experiencing really tough conditions out there. The trouble is, if someone's experiencing a problem with this, the enforcement mechanism is code enforcement, which each city has code enforcement, and then unincorporated areas are under county code enforcement. But of course, those are tied to government funding and backlogs and all of that. But there are government agencies who are tasked with that, and they do. Our office in our legal work works with those agencies. They do inspections, they can make orders to fix violations, they can fine landlords, and they can possibly red tag, which also has the downside of displacing folks. So another aspect of independent living is making sure that residents know their right to privacy. So if someone's in a private room, it's their private space. And so other residents and the operator shouldn't enter without invitation or proper notice. And even if a tenant or resident is in a shared room, the operator's access should be based on necessity. So it should be either an emergency or they're making repairs or showing to prospective residents. And if it's a non-emergency, they should be giving notice. And another issue that comes up is independent living homes are not allowed to store or administer medications to residents, so residents are managing their own medications. And this is an area where complaints about this do actually go to community care licensing because they're overseeing improper activities. And rent increases, so basically if you're in a fixed term lease, like a year-long lease, unless the lease provides for rent increase, the rent should not increase. And then if the lease is month to month, the amount of rent increase allowable depends on the amount of notice given. So obviously most people who are living in these homes are on very fixed incomes, often of SSI. And so this is a tricky part of this as well, but there are certain requirements for rent increases. Okay, we're going to turn it over to John.
Thank you, Hillary. So my name is John Hardy, and I am a mental health consumer. I have been for half my life. I've been working for the county behavioral health services department in consumer affairs since about 2008. And I got involved with this project because I lived in some residential care facilities like SART and a halfway house in another county, and that was pretty tough for me to adjust to those situations. And I've been working for the county. I work at the Zephyr Self Help Center in downtown San Jose, where people can come in and hang out or go to groups, and I teach computer classes there. One of the most common complaints that we receive at Zephyr is people complaining about their board and cares where they live. And why it's so important to me is because there's so much that goes into, in my job, we go to meetings and we talk about recovery and standards and standards of care in the hospital system and so forth. But how can we expect people to recover once they leave the hospital and they have to live in very difficult situations? And why shouldn't we expect that people will end up going back into the hospital after living in bad situations like that? So that's why I'm involved in this. So another workaround that we have in our coalition for addressing these kinds of issues is not just addressing the homes themselves, but by talking to the people that actually live in the homes and informing them about their rights legally, and so that they know what's fair and what's okay and what's not. So we've been, in conjunction with Mental Health Advocacy Project, going out to places like Crestwood and SART, and most recently, on a regular basis, the Literal House, thanks to Garrett over there, and letting people know what their rights are in licensed board and cares. So this is the presentation which I'm going to give you very quickly. This is basically what we do in our residence rights workshops. Well, I just gave you the roadmap. I'll just skip over that. Consumer driven, Lorraine, MHAP. Those are some of the places we've been. And so here's a sample. So licensed board and carers. You have a right to your own bed in a licensed board and care. You have no more than 2 people per bedroom. Your bedroom cannot be a passageway to other parts of the house. They can't put you in the hallway. You have a right to clean linen sheets, blankets, towels, bedspread, etc. Hygiene items, toothpaste, toothbrush, toilet, feminine hygiene products. Telephone where you can make and receive confidential calls. Very important if you want to talk to your friends and family. This is an example of what we tell people. 3 meals a day at a licensed board and care. Generally, between meal snacks must be provided. Meals served in the dining room where residents can eat together. Very important. Food must be high quality and varied. Now, this is all based on what we call regulations, which are not very strict and very specific. So high quality and varied, there's a lot of space there for a lot. Maybe you've heard some stories about ramen sandwiches or something. Oh boy. Modified meals must be provided if prescribed by a doctor, so like MAO diets or special diets. Powdered milk may not be used as a beverage. Kitchen must be kept clean, free of litter, rodents, insects, and vermin. Dishes and utensils must be cleaned after every use. Things that we take for granted in our own home, right? But a lot of people have problems with this. You have the right to wear your own clothes, so they can't ask you to give your jacket to somebody else if they're cold. You gave your own stuff as your own stuff. Staff must provide you with basic laundry services, washers and dryers. You have a right to control your own personal property and money. Like I said, your stuff is your stuff. Help from staff. If you need it, staff must assist you with activities of daily living, bathing, dressing, eating, etc. Planned exercise, recreational activities, including games, sports, and exercise. I don't know how often this happens in a lot of these places. Chess, I don't know. Checkers, I don't know. Safe, comfortable, and furnished indoor and outdoor activity areas. Wide variety of reading materials, including books, magazines, and newspapers. I always make the joke, this does not mean 10-year-old National Geographics. This means current reading material, which you can actually get something out of. Participation in religious activities of your choice. Attend community activities of your choice. Join community groups. Have private visitors during waking hours. Okay, all those are guaranteed by the regulations. You have the right to leave your board and care home. It's a basic freedom. You have a right never to be locked in a room as punishment or for any other reason. If you need help getting to the doctor or dentist, you have a dental or medical problem, they have to help you with that. Assistance with voting. If you have an address, you get to vote. Very important. Send and receive unopened mail. Now, we talk a lot about empowerment in consumer affairs. If you're in one of these homes, it's very important that people understand that they can have a residence council and space to hold meetings just for the residents. That means the operators can't go in there, or they can't sit in there and listen. You can actually form your own, you can have a president, a treasurer, whatever you want, and discuss issues amongst other consumers. All right, that's what I had to say about that. Thank you. I'm going to hand it back to Hillary. Thank you.
Thanks so much, John. All right, we're going to go over discrimination and evictions in 3 minutes or less. Just a tiny topic. So, discrimination. Owners and staff of a board and care or independent living home cannot treat someone differently because of disability, physical or mental, race or national origin, gender, or many other protected categories that are not listed there. Licensed board and cares can ask limited questions about your disability to make sure that you qualify for their services. And operators must grant reasonable accommodations of disability, which are changes of policies or practices that someone needs because of their disability. And these can be quite varied. A reasonable accommodation could be when you pay rent due to the fact that your disability payments come after the first of the month. It could also be, there could be physical accommodations for someone who needs assistance getting in and out of a wheelchair. There could be behavioral accommodations, and landlord-tenant, we're often negotiating kind of second chance reasonable accommodations if someone's mental health symptoms have caused behavioral issues that jeopardize their tenancy. And so we'll enter into kind of what we call a probationary tenancy, where there's an agreement for a certain period of time. They can have various parameters around it. So there's many, many examples. And again, I could talk about reasonable accommodations for a long time. We talk about reasonable accommodations as a dance. It's interactive between the operator / landlord and the resident. So it's a process in requesting it and coming to agreement on an accommodation. Evictions. So this is the most important thing. Board and cares or independent living homes cannot force someone to leave without giving proper notice. And someone cannot be locked out without a court order from a judge, technically comes from the sheriff's office, the lockout notice, that allows the operator to lock someone out. And that comes after the court process. if someone gets noticed to move out of the board and care, or they're threatening to kick someone out, call the Law Foundation /housing lawyer immediately. I have our phone number at the end. And this is really important, and we do a lot of work out in the hospitals, and even if someone's in a psychiatric hospital, the board and care or independent living home must allow them to return unless there's an eviction order from the court, which is, again, only obtained through a very specific process. So that is another 2 hours on a different night. So that, we just really wanted to give you kind of the very broad overview of residents' rights, and thanks so much to John for sharing his many years of experience doing these workshops out there with residents. So if you had questions, I think for the whole panel, we could take them, and I think Uday wants to say something. And then we have some contact information here, and we'll make sure this gets out electronically as well.
So since we're talking about rights and abuse, there was something very interesting that I came up that Young mentioned to me, that there was Assembly Bill introduced about Assembly Bill 1946. So do you want to talk about this?
So the reason why this is important to us is because very rarely is there anything out of the legislature that affects directly room and board environments. And I want to, before I go into this, I want to caution that many times, even within Disability Rights California, my colleagues have approached me and said, well, why don't we use our quite significant lobbying force to pile on a bunch of laws that governs room and boards? And I've always told them no. Because if you do that, these homes are going to go out of business, or they're going to change their business to Airbnbs. You're going to remove an entire stock of housing, and then you're going to have an even bigger problem. So I always tread really carefully as far as advocating for these really broad systemic changes. So, but having said that, this bill is now going through our legislative process. It's an assembly bill. As Uday said, it's 1946. And it basically, it's really rare that we get these types of bills. And it basically creates a new crime. It adds to the penal code 368, which is the abuse of a dependent adult. Not everybody who lives in a room and board is a dependent adult. By virtue of the fact that you live in a room and board typically means that you're not. But there are. And it's a fairly wide definition of what a dependent adult is. And basically, it creates a misdemeanor and a felony. And basically, if somebody, an operator, knows that this person is an elder or a dependent adult, and exposes them to circumstances that are likely to produce bodily harm or physical pain or mental suffering, and in particular, that mental suffering part is really critical. You know, these abuse cases, rarely do we have a case where, you know, somebody is being beaten, you know, in a room and board. We simply do not see that, because when we do, that's usually a law enforcement issue. What we see more is this kind of mental, lower threshold mental suffering type. You know, if you can't live and feel safe in your home over a long period of time, if there's these habitability issues that John and Hillary talked about, that really takes a toll, and you can argue that that's mental suffering. So it now criminalizes that, specifically in the setting of unlicensed room and board stay. It also makes it illegal under penalty of this law to hide victims. So I've gone out in San Bernardino, actually, when we investigated this chicken coop case, and we were trying to find victims. This operator owned 12 homes, and this one home, this chicken coop home, we tried to locate the victims. We knew they were still in the system, and they lived somewhere within her network of homes still. So we're going to all these 12 homes, and what we realized was that she moved them around. So when we were out there, we spent the whole day out there. She basically called all our homes and said, if you guys see people coming around, take Jane Doe, John Doe, move him to house number 2, And then when we come to house number 2, move back to house number 1 or whatever, and we started realizing this because we actually caught them in the act. And so this bill makes it illegal to basically hide victims by moving them around, specifically for room and boards. So anyways, so this is kind of the gist of the bill. I can circulate it to your network. We actually had dinner in our small group before coming here, and we talked about NAMI. NAMI, you guys are a really formidable lobbying force. There's a lot of things that can be done to better this environment, and not necessarily through a legislative process, but through your involvement with county officials and grassroots network like ours, and we have Uday kind of representing NAPI in our coalition. So, so I think it's worth it for some your members to know about this. It affects a lot of your family members and a lot of peers and a lot of consumers, and so I think it's important. And it's very, very rare that we see a bill that targets this particular environment. So hopefully you'll be able to review it and take a look, and maybe that'll drive you to do some more advocacy as well. Thanks.
So maybe we can now open for any questions.